My name's Jamal Chowdhury. I'm the operations manager at the Peel Project. I'm one of the founders of the organisation, which was set up in December 2020 during the midst of COVID. So today we have a community health fair. This is our second community health fair event. We held this event last year. It's funded by Hull City Council's Public Health, and ultimately we've got a whole load of organisations here: Samaritans, NHS, City Healthcare Partnership, Drug and Alcohol Advice Services, Cancer Alliance Services, and for the first time we've got actual testing, screening activity going on. So there's blood pressure checks, diabetes check, BMI checks happening. Last year we did this event when we approached Public Health, Hull City Council's Public Health. We kind of explained that we want to do a community health fair to bring organisations and communities together, and ultimately, we've got about 300-400 people here today, and we've got fun fair rides. We try to keep it fun because health fairs are generally seen as corporate events. They're held in city halls, and what we've tried to say is bring out services into the community. And we've also got free chicken biryani for everybody.
So I'm Kate Harvey. I'm from the Be Well Health and Wellbeing Service from CHCP, and we cover the whole of the then PCN. We're here today. We're offering blood pressure checks, and we're also offering diabetes risk assessments. With regards to the blood pressure checks, we're just trying to improve awareness of the importance of knowing your blood pressure. Having high blood pressure puts you at an increased risk of having things like a heart attack or a stroke. So early detection is key. The earlier that's detected, then you can have medication from your GP, you can implement lifestyle changes which will reduce your blood pressure and reduce your risk of those things like heart attacks and strokes. We're also trying to improve awareness of how you can have your blood pressure checked. So that can be done at your GP practice. You can purchase a monitor and keep an eye on that at home. But you can also visit a pharmacy. Lots of pharmacies now offer free blood pressure checks to people over the age of 40.
Sometimes there are barriers when reaching out to the healthcare services, whether it's language barriers, whether it's cultural barriers, whether it's stigma that's attached to especially mental health and other things. So for the Peel Project and other communities like the mosques to come together to spread the word that there are health services available for you, and if you feel shy or if you feel unable to be able to approach them, the Peel Project and ourselves and other people are there to come in between. So it's a bridge, kind of a networking occasion, opportunity, but it's extremely important so that the healthcare services knows that there are people that are in need, and the people who are actually in need know that there are places to go.
We're an organisation which is made up of local residents, parents and teachers, and when we started this event, we started as a youth organisation, and then as helping children we realised that we've got to support the families, the households that they're supporting. So we've got a women's programme and we've got so forth. Now we've got men's programmes and activities going on, and one of the things that has kind of come along is health organisations have approached us and they've said that ethnic minority communities are accessing health services, underserved. There's a lot of underserved communities that are accessing health services, and when we've spoken to our service users, community members and everything, they said that some people don't understand what health services are. It's very complex, the UK healthcare system. Nowadays you've got the pharmacies offering services, a lot of the services are online, and for communities who don't speak English as a first language, who've only been in the UK for 5-10 years, they don't have that understanding of UK healthcare system. So by bringing organisations together here, what we're hoping to do is get communities to see health services directly within their areas. It's a safe space, and also health services are also getting understanding of the barriers that exist and how they need to change to deal with that.
Hello, my name is Lottie Riddle. I work for Places Leisure, which is part of Places for People. We've come here today to the Peel Project to be part of this amazing event, interacting with the families, the kids. Part of what we do is get children physically active, so we brought our smoothie bike today to get them pedalling and also get them a really fresh fruit smoothie to get them eating healthy as well. I'm working with the Peel Project for a couple of years now, giving them grants to support some of their projects, such as the children's activities, the wellbeing sessions, and that has continued and grown from there, supporting them to get their office building, their office space, and then building across to a partnership with the leisure team as well, looking at ways to get their families and the community here active.
My name is Mark Lovell. I'm a Chief Inspector with Humberside Police, and I work within the Community Safety Unit. And the Community Safety Unit, two different areas of responsibility, one of them being engagement, which includes community cohesion, and the other side of it is problem solving, crime reduction, and that's what we're doing. So today's a great opportunity to come down and engage with members of our local community.
This park here used to be somewhere where people would hardly ever come. Over the last few years, with all the work that the Peel Project's been doing, bringing families together, bringing children together, giving opportunities to those who are less fortunate to be able to come and express themselves, giving them something positive to do, and we've seen the impact that it's had on the community.
It's just great to see people out. I was at a meet a few weeks ago and folk were saying how scared they were to come out of the houses, and it's just to see that confidence coming back. You know, and actually all that kind of rioting we saw, you know, hasn't sort of carried on. You know, it's been firmly dealt with, and you know, hopefully we're in a much better place as a community.
I think opportunities like this are really, really important for the community, because when you see somebody in a uniform, or you come to your hospital appointments or go to see your doctor, a lot of people find it quite overwhelming, a little bit nervous about it, and don't find us particularly approachable. Whereas if you've been to something like this, you've spoken to us face to face already in quite an informal setting, we've been able to give you a little bit of information about the scope of the services we offer. You might feel a little bit more confident about approaching us in the future.
In terms of the Peel Project, I absolutely love to come along here. You know, I've been coming, you know, for the last few years. They do some fantastic work, and in a prior role that I had, I always worked with Jamal and a number of other people, so it's actually great to be here. But for me, it's really important. It's a real opportunity for everybody to get together and actually to see adults and young people, but all the services. And I think I've seen some progression as well with that. And what I can see today is there is a lot of materials in different languages, which I really celebrate the fact that that's taking place. So I love today, it's really, really important. But also as part of the Healthy Holidays programme, of which we do a lot across the city. So I'm really, really happy to support, you know, the Peel Project in whatever way I can.